Hi, I'm Danny Trainer, and I'm continuing to welcome you and cover the Space Coast Medicine Week here in Brevard County. Tonight, we're going to highlight and feature the 26th annual Brevard County Long Term Care Symposium. This was a gathering of a lot of people who offer services and some drug manufacturers and things like that, all getting together to exchange information about long-term care and where it's going and what the future holds. In fact, many of the speakers tonight will be featuring what they think are the changes that they see coming down the road, and some of them are going to be big. I think you'll want to hear about it. In fact, stay tuned because I'm going to be talking to one of the speakers from tonight's symposium. But first of all, we want to introduce and talk to Dr. John Potomski, who's the man who came up with this idea 26 years ago. And when he started out, it was just a few people, and now it's over 400 attending. But I'll let him explain more. I'm joined by Dr. John Potomski, and this was your idea. 26 years ago, you said there is a need in the Brevard community for long-term care examination and education. And you started this idea, and here we are. You started out with a few people, now we got hundreds of people. Why? What did you see was lacking in the community that you thought that we could fill in a gap?
Well, at that time, 26 years ago, there was really no education aimed at the long-term care arena. And the long-term care arena at that time, going back then, was mostly in the nursing homes. There was conferences you can go to for acute care in the hospitals and office care and about different disease states, high blood pressure, diabetes, etc. But there was no education aimed at the long-term care arena and also the regulations that go into it.
Right.
And the Congress and CMS passed some regulations in 1987, which was the Ober Act of 87, which really drastically reformed rules and regulations for nursing homes. Then in 1991, it was updated again, and it hasn't really been updated again until this year. And this year, there were some current regulations that were proposed, and a number of us from professional organizations such as ours gave comments to CMS about how we think we can improve care further in long-term care arena. So at that time, we started in our first year, we had about 80 people that showed up,
right.
And that was great. And most people had said that, wow, we finally have something that's aimed at us and giving us some education on the work that we do every day. And every year this has grown, and now we have over 450 people that attend this meeting on a yearly basis.
All right, now you've seen your symposium grow, but at the same time, have you seen progress in the community in the long-term health care?
Oh, there's been tremendous progress, and now long-term health care is no longer just limited to the nursing homes. There's the nursing homes, there's rehab centers, we have assisted living facilities, we have independent living facilities for seniors, we have home health care, we have hospice care, we have palliative care, so we have the whole continuum of health care in Brevard, and things have improved drastically. Many years ago, people in the nursing homes, there was higher rates of dehydration, there was higher rates of bed sores, all these things, and it has become tremendously improved over these years. And it's from education like this, with some urging from CMS and the government, but education like this is really what helps improve quality of care.
Well, one of the things I heard tonight in the symposium was we want to break that entrenched pattern of care and make it more individualized for the patient.
Exactly. That's getting away from the institutional model where everybody has to eat the same food, everybody has to eat at the same time, they all have to go to bed at the same time, come to a patient, why are you up yet? It's 10 o'clock. We're getting away from that and doing patient-centered care. And a couple of our speakers had mentioned that as part of the program, that we have to tailor the needs to the patient, not to our requirements as healthcare providers.
Well, it also speeds up recovery too, doesn't it?
Definitely, tremendously, because if people are unhappy, they're depressed, they're not going to recover as well. It's been proven in many studies that there's powerful chemicals that are released by the brain when people are not depressed that help improve and speed up recovery. And
we're going to be talking to some of those speakers in just a few moments and find out more about what the future holds in the long care aids in the community. Thank you, Doctor.
Thank you very much, Danny.
Dr. Umami, the speech that you gave tonight was a little bit about vascular diseases, wound care. You covered a lot of things, and I would assume that with age, your circulatory system changes.
Absolutely. Tonight we talked about arterial and venous disease in the long-term care patients and wound care. So yes, over years we get blockages in our blood vessels, and
plus standing upright puts a lot of pressure.
Absolutely. That's venous disease. All leads to wounds, and in our long-term care patients, we become concerned when they have wounds that need to be treated.
Right. Well, now you were talking about several different kinds of wounds, anything from ulcers, from possible amputation. And of course, it all has to do with, as far as recovery goes, how well the blood work, the circulatory system's feeding and fixing.
Correct. Basic premise, no blood flow translates into amputation. Wounds aren't going to heal without blood flow, and it's important that we have blood flow.
And of course, as we get older, it's just like pipes in our house, right?
Yes. You look at your pipes 20 years later at home, cut the pipe in half, it's full of debris. Your blood vessels, mine, we're not like somebody who's 17 years old. So all of our blood vessels have debris in it. And over time, that debris becomes blockages,
right,
which restrict blood flow.
But a lot of the solutions that were available 10 years ago have changed, and you talked about that also.
Yes, 10 years ago or more, we did a lot of open surgery. Today we can do it minimally invasive in the office, no general anesthesia. Patients can come in and be out in about an hour.
Wow.
That's a big breakthrough in our field.
Now tell me a little bit about your company too, because TPAS, right?
Right, I'm with TPAS Healthcare. I'm one of the co-founders of TPAS Healthcare. We're a multidisciplinary group with general surgery, wound care, hyperbaric medicine, and infectious disease. So we encompass the whole gamut of wound care.
Right. Well, now, speaking of wound care, that's one of the things that hospitals are concerned about too. They don't want patients coming back to the hospital, do they?
Correct. In the future, these patients who bounce back from long-term care facilities, there'll be a payment reduction from CMS. That's coming. Incentives, that's right. So the better option is, let's treat these patients properly in the long-term care facilities.
So that's going to mean a little bit more specialization and paying attention to the patient a lot more, right?
Absolutely. The patient needs to know that some of these problems are fixable right there in their facility.
Right. And one of the things is to get them up and get them moving, right?
Yep. Walk.
Walk. All right. Thank you.
Stop smoking too. That's our ticket.
Right. And cut down on drinking.
You got it.
All right.
Perfect.
Thank you, doctor.
Well, One Senior Place is a resource environment for anything that has anything to do with seniors. So what I like to do is say that we help people. Anybody can come in if they have questions in relation to anything senior oriented, whether that's Medicare insurance, healthcare questions, recommendations, questions about facilities, medications. And we have professional nurses, care managers that can sit down with them for free and talk to them about what their options are.
Okay, and you do assessments also?
Oh, we do. We go out into the field, we do clinical assessments, and we could also set up services for people. We're also a connection maybe sometimes for family members who live out of state, who want somebody to go check in on their loved one and do those sorts of things. We're happy to do that too.
All right. So, and the name of the business is?
One Senior Place. Thank you so much.
One of the featured speakers this evening at the symposium is Carmen Moment, and you're educatoring. That's an interesting phraseology.
Like it, huh?
Yeah, I do. But I think it needs a little bit of explaining.
Probably. So,
yeah. Tell me a little bit about it and what you're going to be talking about tonight, because you're talking about culture change, right?
Yes, right. Hi, Danny. Thank you so much for interviewing me. My business is called Educatoring. My tagline is catering education for compliance and culture change, and what that means is regulatory compliance and culture change, which is a national movement that's been around almost 20 years now. And what it means is we're trying to change the institutional culture of institutions. Now, do you think that's hard or easy?
I would think it's very hard because just the word institutionalized means it's entrenched.
Right. You're so smart, Danny.
No.
Really, because it shouldn't be this hard. So we need anyone listening to do whatever they can to change.
But how do we do it?
Well, it's really actually not that hard at the same time. See, a lot of our policies and our procedures that we're entrenched into are holding us back. So guess what? A nursing home doesn't have to have 3 shifts. A nursing home doesn't have to wake people up at a certain time. A nursing home should not wake people up. And they should
give them a pill so they can go to sleep.
They should honor your body's need for sleep. My gosh, people are sick. They're having rehab. Do you realize sleep is one of the most important things that can happen to a body? And yet, what goes on in most institutions? We wake them up all night, we have loud noises, and we wake them up in the morning. Why? Because we have an institutional schedule and everyone has to go to breakfast.
Right. Right.
So we are trying to change the institutional nature of institutions and really to create home again for people. And your home ran different than my home, and your body slept different than mine.
And my job that I did years ago was a different shift, or maybe a different time,
right.
and I have a different body clock.
Right.
Yeah.
So it's really becomes exciting to try to honor individuals and their individual preferences.
You have your task cut out for you because entrenched means this is a way we've always done it.
That's right.
You know?
Now the good news is many homes around the country are doing it different. So guess what I usually say? If they can do it, you can do it.
There you go. Good luck to you.
Thank you. Thank you.
I hope you win.
Yeah, me too.
By the way, you're looking at Stuart. Stuart is a therapy dog, and Stuart and his human companion is Sheila. And it's Felock?
It's actually Felock Wilson now.
Oh, Felock Wilson. Well,
Yeah.
Congratulations. Now, tell me what a therapy dog does. I know I have friends and I see them in various places and they have their dog with them. And many of these are therapy dogs.
Hopefully they're therapy dogs. There's also a lot of people doing fake service dogs too. But therapy dogs are based on their temperament. They go to nursing homes, assisted living facilities, work with children. We volunteer at the library too. Children come in and read to therapy dogs. Therapy dogs are here to make people feel better. They are not providing a service for people,
Right.
other than to make you feel better.
Okay, so they're not, because we have scientific proof that petting animals brings blood pressure down, don't we?
Absolutely, and gets rid of depression and all sorts of good stuff.
And how can somebody, if they're interested in a therapy dog, who should they contact to get more
I
information?
would Google Therapy Dogs Incorporated, and that tells you all the things you need to know about what makes a dog a therapy dog. And then there are tester observers all over the country. I happen to be one. And you contact a tester observer. The dog has to be at least 1 year old. And then it has a test, can't study for.
Right.
And 3 observations where I make sure the dog is okay around children, around people in wheelchairs, and okay with other dogs. They can't be dog aggressive.
Gotcha. So, and the name of it is Therapy Dogs
Incorporated.
Incorporated.
Yes.
Thank you.
You're welcome.
Well, we have been attending the Long Term Care Symposium and have learned a lot about what's coming down the road, what's going to be changing, and a lot of it looks very, very good, especially when it comes to individual patient care. Very encouraging. But this is just part of the medical week here in Brevard County. Coming up this Saturday, just as a reminder, there's going to be a health fair held at the Hilton Rialto, and the public is cordially invited. It's absolutely free, and you get your blood pressure checked, and maybe get some free goodies and things like that. So come on by if you get a chance. Also, there's going to be coming up the Goodwill ambassadors, the Doctors Goodwill Foundation ambassadors are going to be recognized this week, and so are the humanitarians. All people that bring medicine to Brevard County. Thank you for joining us. I'm Danny Trainer. Have a great evening.